Hi guys, welcome to Raaonline. So today we are going to see about case discussion pertaining to the urinary tract infection. So I will show you a case and a set of questions. Let us answer one by one. So we'll go to the case study now. So here we have a case where the patient is going to have fever and chills for 3 days duration and a history of painful urination is present, as dysuria is there, and she is a known case of uncontrolled type 2 diabetes. So what is the diagnosis? The diagnosis is going to be a case of urinary. So what is the diagnosis? So it's going to be a case of urinary tract infection. And types of UTI. So it's going to be upper urinary tract infection, and we have the lower urinary tract infection. So upper, it's going to be example pyelonephritis, and urethritis. And lower example is going to be the cystitis and urethritis. That's going to be the type of UTI. So what are the various risk factors? So the common risk factor is going to be the dehydration. Then we have the pregnancy. And we have the children's. We have the old adults. And anyone who is going to have the anatomical abnormality. Anatomical abnormality of urinary tract. And any associated comorbid, like the patient may be having something like uncontrolled type 2 diabetes. So they are all at high risk of developing this kind of infection. So what is the etiological agent? So whenever we are going to study about this kind of pathogen, we have many organisms like bacteria, virus and fungi. So example for bacteria, we have the enterococcus, we have the proteus, we have the staphylococcus saprophyticus, and we have the staph aureus, we have the fungus like candida, we have the virus like adenovirus, and we have the BK virus, so which is going to be a ubiquitous polyomavirus, which is going to cause urinary tract infection. And what is the specimen for the test? So the most common specimen which we are going to take is going to be the urine. And how it is going to be transported to the lab? Within 2 hours. In case if there is going to be any delay, we can add an bacteriostatic agent like boric acid. And what is the culture medium in which we are going to stick the particular urine specimen? Either we can use something called cled agar, or we can use blood agar along with mechanical agar. And here the cled agar is always superior to mechanical agar in many ways. So certain species of strep doesn't grow in mechanical agar, but it grows well in cled agar. And the fungal pathogen like Candida grows well in cled agar, but it will not grow in mechanical agar. And certain fastidious organism it can go in cled agar, but it will not grow in mechanical agar. So this is a major difference. But most of the time either we can use cled agar or we can use blood agar along with the mechanical agar. So this is a culture medium which we are going to use. Again, the particular full form of cled agar is going to be the cysteine lactose electrolyte deficient. Since it's going to be electrolyte deficient, so organisms like Proteus will not swarm in this culture medium. So this is about the culture medium. And what do you mean by the term cause concept? So whenever we have an infection which is going to involve the urinary tract, we are going to analyze a specimen for the organism. So here urethral specimen may have the organisms in it, so it's going to be normal flora.